Let's talk about what to expect after a new diagnosis of cancer. There's a few things to talk about. The first is that your team is going to be assembled. Your team may include a surgeon, a radiation oncologist, a medical oncologist, potentially a plastic and reconstructive surgeon in certain circumstances. You may get connected with a genetic counselor, a social worker, a dietitian, a palliative care physician. And so all of those are potential team members you may be set up with. Each situation requires certain team members, but almost certainly never all of the team members. So that's number one, is assembling the team. Number two is staging. So after a new diagnosis of cancer, we need to figure out, does the cancer look like it's localized in one area, or does it look like the cancer cells have broken away from where they started and have taken root in other parts of the body? Does it look like they're in lymph nodes close by, or in the liver or the lungs? And so that's typically done through a number of different types of scans, sometimes CAT scans, sometimes PET scans, sometimes MRIs. And the type of scan, it's a tool, and so we use the right tool for the right job. At the conclusion of this time period of scans, your team of doctors will determine the stage of the disease. And then the team of doctors is going to come up with the treatment plan that is tailored to the specifics of the situation. That could include, in certain circumstances, surgery, radiation therapy, chemotherapy, immunotherapy. Sometimes the chemotherapy comes first, sometimes the radiation therapy comes first. And so the treatment plan is based on the stage and the collective decision between your providers. We've talked about what happens in the time period after a new diagnosis of cancer. The team is assembled, the staging studies have been done, the stage of the cancer has been determined, and the team is coming up with a plan. One thing that is important to talk about with your team is whether the treatment plan is expected to be curative and to offer the hope of a cure, or in certain circumstances, the staging studies have revealed that the cancer is not really expected to be curable. And so that's another piece of information that's being determined in this initial time period after a diagnosis of cancer.